Hey everyone, and welcome to another deep dive.
Glad to be here.
Today we're going to be tackling adrenalectomy. And I know that sounds kind of scary.
It does have a certain ring to it.
Yeah, but it's a really important topic, especially if you or someone you know is facing this surgery.
Absolutely, knowledge is power, right?
Right. So we're going to break it all down for you using this super detailed medical text as our guide.
It's pretty comprehensive.
It is. We're talking minimally invasive versus open procedures.
Oh,
The pros and cons.
we'll cover it all.
So yeah, get ready to be an adrenalectomy expert.
Haha, exactly.
So let's start with the basics. Why would someone even need an adrenalectomy in the first place?
Well, the adrenal glands, these tiny little organs, they play a bigger role than most people realize.
Okay, so they're not just like an afterthought.
No, not at all. They're actually pretty important.
Right.
They pump out hormones that affect your whole body, everything from blood pressure to metabolism to how you handle stress.
Wow. Okay, so they're small but mighty.
You got it.
So when do they become a problem? Like when does surgery even enter the picture?
There are a few scenarios where an adrenalectomy might be necessary. Sometimes it's because of a tumor.
Okay, a tumor in the adrenal gland itself.
Right, and these tumors can be benign or malignant, meaning cancerous.
So is that always cancer?
Not always. Sometimes they're just causing problems because they're taking up space or messing with hormone production.
Oh, I see.
In other cases, you might have a functional tumor, which means it's actually overproducing certain hormones.
That sounds bad.
It can lead to some pretty serious conditions like Cushing's syndrome or Conn's syndrome.
And I'm guessing that's when surgery becomes necessary.
Exactly. When these tumors are causing problems or posing a health risk, that's when the surgeon steps in to remove the affected adrenal gland.
Okay, so it's not just about cancer. There are other reasons why someone might need this surgery.
Right. It's all about restoring balance and function to the body.
And I've heard there are different ways to do this surgery.
Oh, yeah. There's not just one way to do an adrenalectomy.
That's what we're here to talk about, right? Minimally invasive versus open procedures.
Exactly. We're going to break down each approach and explain when one might be preferred over the other.
Okay, so let's dive in, starting with what everyone seems to be talking about these days, minimally invasive surgery.
It's definitely gained a lot of popularity, and for good reason.
I'm all ears.
Well, think about it. Smaller incisions, less pain, shorter hospital stays. Who wouldn't want that?
Sign me up.
It sounds great, right? But it's important to remember that minimally invasive surgery isn't right for everyone.
So when is it not a good option?
Well, if the tumor is very large, or if there's a suspicion that it might be malignant, an open procedure might be the safer bet.
I guess it makes sense you need more room to maneuver.
Exactly. And sometimes the tumor might be invading nearby structures like the liver or even the vena cava, that's a major blood vessel.
Oh, wow, that sounds serious.
It is. In those situations, an open approach gives the surgeon better access and control.
Okay, so tumor size, location,
Yeah.
those are key factors.
Absolutely. And we can't forget about previous abdominal surgeries.
Oh, right. I bet that complicates things.
Scar tissue can make it difficult to access the adrenal glands laparoscopically.
So the surgeon has to weigh all these factors before deciding on the best approach.
It's a personalized decision based on each patient's unique situation.
Okay, that makes sense. So we've talked about when open surgery might be necessary, but let's get back to those minimally invasive techniques. They sound pretty amazing.
They've revolutionized many surgical procedures, including adrenalectomy.
I'm picturing tiny incisions, tiny instruments, like it's almost science fiction.
It's pretty incredible what surgeons can do these days.
Let's break it down, starting with laparoscopic adrenalectomy. That seems to be the most common minimally invasive technique.
It is. It's been the gold standard for a while now.
So walk us through what happens during a laparoscopic adrenalectomy.
All right, so first, imagine the patient comfortably lying on their side, carefully padded for support.
Okay, I'm with you.
The surgeon makes a few small incisions, usually no more than an inch long.
Wow, that's tiny.
Right through these incisions, they insert specialized ports, which are like little doorways for the surgical instruments, and a laparoscope.
I've heard of a laparoscope. What exactly is it?
It's basically a thin telescope with a camera on the end that transmits high-definition images to a monitor.
So the surgeon is seeing everything magnified on a screen.
Exactly. It's like having a front row seat to the surgery, but without the blood and guts.
Uh-huh. Right? So the surgeon is looking at the screen and using these tiny instruments to operate.
Precisely. They use these instruments to carefully dissect and remove the adrenal gland.
And all this through those tiny little incisions.
Yep. It's pretty remarkable.
But the adrenal glands aren't just floating around in there, right? They're surrounded by other organs and blood vessels.
You're right. The anatomy is complex, and the surgeon has to be very skilled in navigating those structures.
I bet that adds to the challenge.
Definitely, especially on the right side of the body.
Why is the right side more challenging?
Well, on the right side, you have the liver and the inferior vena cava right there in close proximity to the adrenal gland.
Those are some pretty vital structures.
They are. The surgeon has to be extra careful when dissecting around them to avoid any damage.
It sounds like threading a needle, but on a much larger and more delicate scale.
You could say that. And on the left side, you have the spleen, the pancreas, and their blood vessels to consider.
So each side presents its own unique challenges.
Exactly. But skilled surgeons are trained to handle these complexities and perform the procedures safely and effectively.
It's amazing what they can do.
Mhm.
It really is. So laparoscopic adrenalectomy involves a lot more than just tiny incisions. It's a delicate dance of skill and precision.
Absolutely. It's a testament to the advancements in surgical technology and the expertise of surgeons today.
Speaking of different techniques, I've also heard of something called retroperitonioscopic adrenalectomy. It sounds like it goes in from the back.
You got it. Retroperitonioscopic adrenalectomy, or RPA for short, is another minimally invasive option that's gaining popularity.
Okay, so instead of going through the abdomen, they go in through the back.
Exactly. They access the adrenal glands from behind the abdominal cavity.
And what are the advantages of this approach?
Well, for starters, it avoids going through the intestines and other organs in the front of the abdomen.
So less disruption to those organs.
Right. And because the incision is in the back, it can be less painful and heal faster.
That's definitely a plus.
RPA is also particularly well suited for bilateral adrenalectomies, which means removing both adrenal glands.
Oh, interesting. So they can do both sides without repositioning the patient.
Exactly, making it a more efficient procedure.
So laparoscopic and retroperitonioscopic adrenalectomy both sound like pretty amazing, minimally invasive options.
They've really changed the game for many patients facing adrenalectomy.
But let's not forget about open adrenalectomy. I imagine there are still cases where that's the best approach.
Absolutely. Open adrenalectomy remains a valuable option, and it's sometimes the safest and most effective way to remove the adrenal gland.
So when would a surgeon opt for the open approach?
Well, as we mentioned earlier, large tumors or tumors that are suspected to be malignant often require an open procedure.
Because they need more room to work.
Exactly. And if the tumor is invading surrounding structures, an open approach allows for better visualization and control.
Makes sense. So it's all about choosing the approach that gives the best chance for a safe and complete removal of the adrenal gland.
That's the ultimate goal.
Okay, so we've talked about the why, the different approaches, but what about the how, what actually happens during an open adrenalectomy?
Well, first, the surgeon makes an incision either down the middle of the abdomen or just below the ribs.
So it's a larger incision than with the minimally invasive techniques.
Yes, significantly larger.
Yeah.
Then they carefully retract the abdominal muscles to expose the adrenal gland.
So they're essentially opening up the abdomen to get a clear view.
Exactly. From there, they meticulously dissect the adrenal gland from the surrounding tissues, being careful to avoid damaging any nearby blood vessels or organs.
I can imagine that takes a lot of skill and precision.
It does. Open adrenalectomy requires a high level of surgical expertise.
And once the adrenal gland is removed...
They close the incision and the patient begins their recovery.
Okay, so regardless of the approach, the goal is the same safe and complete removal of the adrenal gland.
That's right. And then it's all about recovery and getting back to your life.
Well, we'll dive deeper into recovery and all the other aspects of adrenalectomy in the next part of our deep dive.
Looking forward to it.
We'll be right back after a short break.
Sounds good.
All right, we're back. And before the break, we were talking about open adrenalectomy.
Yeah, when you just need to get in there and have a good look around.
Exactly. So we've covered the why and the how, but what about the after? What can patients expect during recovery from an adrenalectomy, whether it's open or minimally invasive?
Well, right after surgery, you'll be closely monitored in a recovery area.
Making sure everything is stable.
Exactly. The medical team will be checking your vital signs, like your blood pressure and heart rate, and making sure you're comfortable.
And I imagine pain management is a big focus at this stage.
Oh, absolutely. You'll likely have pain medication through an IV initially, and then transition to oral medication as you recover.
Okay, so pain control is key.
Definitely. And your diet will also be closely monitored, starting with clear liquids and gradually progressing back to a regular diet as you heal.
So slow and steady wins the race.
Exactly. And as you start feeling better, you'll be encouraged to get up and move around.
Even after major surgery.
Even after major surgery, gentle movement is important. It helps prevent complications like blood clots and pneumonia.
That makes sense.
Mm.
So walking around is encouraged.
Absolutely. Just listen to your body and don't overdo it.
Okay, so pain management, rest, gradual activity. What else can help with recovery?
Well, staying hydrated is crucial.
I can imagine.
Drinking plenty of fluids helps flush out toxins and promotes healing.
And I'm guessing a healthy diet plays a role too.
Absolutely. Eating a balanced diet with plenty of protein and nutrients gives your body the building blocks it needs to repair itself.
So it's all about supporting your body's natural healing process.
Exactly. And we can't forget about the emotional side of recovery.
Oh, right. Surgery can be a stressful experience.
It can, and it's important to acknowledge and address any anxiety or fears you might have.
Talking to loved ones, a therapist or a support group can be really helpful.
Absolutely. Sharing your feelings and connecting with others who understand what you're going through can make a big difference.
So it's not just about physical healing, but emotional healing too.
Exactly. It's a holistic approach.
Well, we've covered a lot of ground today, but before we wrap up, I want to touch on one more important aspect, hormone replacement therapy.
Right, because the adrenal glands produce essential hormones like cortisol and aldosterone.
And if those glands are removed, the body might not be able to produce enough of those hormones on its own.
Exactly. That's where hormone replacement therapy comes in.
So it's essentially providing the body with the hormones it's missing.
Exactly. Your doctor will monitor your hormone levels and prescribe the appropriate medications to keep things balanced.
That makes sense.
Yeah,
So hormone replacement therapy can be a crucial part of the long-term recovery process.
it is. For many patients, it helps them regain their energy and overall well-being.
Well, this has been incredibly informative.
We've covered a lot.
We have. From the different surgical approaches to recovery and potential complications, it's clear that adrenalectomy is a complex procedure.
It is. But with advancements in surgical techniques and a focus on personalized care, more and more patients are able to make a full recovery.
That's reassuring to hear. So if you're facing adrenalectomy or know someone who is a baby, remember that knowledge is power.
Absolutely. Arm yourself with information, ask questions, and advocate for your needs.
And don't forget the importance of emotional support and self-care throughout the journey.
Exactly. Taking care of your mental and emotional well-being is just as important as taking care of your physical health.
Well said. Well, that wraps up our deep dive into adrenalectomy. I hope you found it informative and empowering.
Thanks for having me.
And to our listeners, thank you for joining us. We encourage you to continue your research and have open conversations with your healthcare team. Remember, knowledge is power, and you deserve to feel informed and confident every step of the way. And we're back for the final part of our deep dive into adrenalectomy.
It's been quite a journey.
It has. We've explored the why, the how, the recovery, and even touched on the emotional aspects.
It's more than just the surgery itself.
Exactly. So as we wrap up this deep dive, what are some key takeaways for our listeners? What do you think they should keep in mind as they continue their research and maybe even prepare for their own consultations?
Well, first and foremost, I want to emphasize that adrenalectomy is not a one-size-fits-all procedure.
Right, we talked about that.
Yeah, the best approach, whether it's laparoscopic, retroperitonioscopic, or open, really depends on the individual patient and their specific situation.
So there's no magic bullet.
No, not at all. It's a personalized decision that should be made in consultation with a skilled and experienced surgeon.
I'm sensing a theme here, personalized care.
Absolutely. Every patient is unique, and their treatment plan should reflect that.
Okay, so no two adrenalectomies are exactly alike.
Right. And another important takeaway is that knowledge is power.
I love that.
The more you understand about the procedure, the different approaches, the potential risks and benefits, the more empowered you'll feel to make informed decisions about your health.
It's all about being an active participant in your healthcare journey.
Exactly. And don't be afraid to ask questions.
Of your doctor.
Yes, of your doctor, of your nurses. Do your own research. Gather as much information as you can.
It's your body. You have the right to be informed.
Absolutely. And remember, recovery takes time.
It's a process.
It is. Be patient with yourself. Listen to your body. And don't be afraid to ask for help when you need it.
And don't compare your recovery to anyone else's.
Right. Everyone heals at their own pace.
So true. Well, this has been an incredibly informative deep dive.
I've enjoyed it.
Me too. And I hope our listeners have found it valuable as well.
I hope so, too.
We've covered a lot of ground, but remember, this is just a starting point.
Keep learning, keep asking questions, and keep advocating for your health.
Well said. Well, that wraps up our deep dive into the world of adrenalectomy. Thank you for joining us, and we wish you all the best on your healthcare journey.